Is everything on that should be on, Jeff?
Yeah, you're good to go.
All right. Good morning and welcome to the Public Health and Human Service Board meeting for May 21st, 2019. We will call the meeting to order. The first item we have is the approval of the consent agenda. Would anyone like to pull anything? Can I get a motion?
So moved.
Support?
All in favor?
Aye.
Motion carries. Staff report. So exciting.
Good morning. So we have for you today the 2018 financial report for Public Health Human Services. The document that you have in front of you is going to have all of the pie charts and graphs that you're going to see on the screen, but there's numbers attached with it, so you'll see the documentation that made those up. So what we have here is a snapshot of our unaudited financials for 2018. The state auditors are actually coming out the first week of June and will be auditing all of the county's books, and so these, I have to say, these are unaudited numbers. The expenses and revenues don't change. Overall, in the big snapshot, we spent 85% of what was budgeted, and we received almost 5% more in anticipated revenue for the year. Where does the money come from to fund all of our programming? State and federal dollars make up 36% of our funding. Charges for services such as reimbursements from health insurance plans and miscellaneous revenue such as funds recouped from estate recoveries adds another 12%. A very small amount of our revenue comes from the liquor, beer, and wine license fees, and the remaining 53% came from county taxes. And what do we do with it? Public Health and Human Services has three distinct areas of program responsibility. Income maintenance makes up 28% of our programming costs, social services 62%, and public health 10%. This graph shows the program expenditures of these three areas. And then we'll look at them individually. First, we'll look at the income maintenance area. Our income maintenance staff administer Minnesota healthcare programs such as MA and Medicare savings programs. They also administer financial assistance programs such as SNAP, food support, cash assistance, and emergency assistance. This graph shows the operational programming costs are funded mostly from federal and state agencies. A small amount is derived from recoveries such as collections from program overpayments, and the remainder is funded with county tax. This revenue covers the cost of staff salaries, training, and other operational costs that are directly program related. Last week in Cook County Connections article, we talked about estate recoveries. Federal and state law require local counties to recover certain medical assistance program costs from a recipient's estate after they die. Under certain circumstances, local agencies are allowed to retain a portion of the collections for their effort. The remainder is paid back to state and federal agencies to maintain the MA program for future clients. In 2016 and 2017, Cook County inadvertently retained all of the collections that we received. These recoveries were correctly reported to DHS in 2018, and the appropriate portions were returned back to the state and federal agencies. So this graph that you're looking at explains the estate recovery allocation over the last 3 years. During this 3-year period, $101,000 was collected from estate recoveries, of which $76,000 was returned to the state and federal agencies, and almost $25,000 was able to be retained by Cook County. The actual collections for 2018 alone was a little over $7,500, of which Cook County was allowed to retain $2,900. The Income Maintenance Department administers several programs with expenditures that are paid directly by PHHS. This includes reimbursement for eligible client expenses such as cost-effective insurance premiums, Medicare Part B premiums, county-paid burials, a county share of the nursing home costs for residents under age 65, healthcare access, and provider transportation. As you're looking at this graph, you'll see there's certain items that are asterisked. We are fully reimbursed by state and federal money for payments that we make for cost-effective insurance premiums, Medicare Part B premiums, and healthcare access, and those are for clients that are eligible to receive those programs. We are also improving our process to seek more reimbursements for provider transportation from the insurance companies. There are also I want to make a note here, centralized expenditures are payments that are made by DHS on behalf of the counties but sent directly to vendors or clients. Counties don't see this money, so it's not included in any of our reports. This would be payments such as the MFIP program, the Minnesota Family Investment Program, SNAP, General Assistance, Group Residential Housing, and Minnesota Supplemental Aid and Medical Assistance. Those payments do not flow through PHHS, but are paid from DHS directly to clients or vendors. And because the funding for these programs does not pass through our agency, we don't show it in our reports. However, our staff actually perform all of the administration for these programs on behalf of the state and federal agencies to provide services to our clients. In talking with Allison, we anticipate doing a future report to the board to show just how much it is that we are, through the Minnesota County Human Services Cost Report, which will provide more comprehensive representation of the costs and revenue sources involved. We also provide child support services through a contract with Carleton County. 68% of the funding is provided by federal and state dollars, and the remainder comes from county tax. And then on to social services, which makes up 62% of our programming costs. Funding for social services operational programming was evenly split between federal and state dollars and county tax last year. Fees and recoveries made up a very small portion. Direct staff funding covers the cost of social worker salaries, training, and other operational costs that are directly program related. As a result of becoming fully staffed in 2018, our agency showed a 50% increase in planned time study revenue. This is because some of our funding is based on the number of employee hours reported and the type of work performed. A loss of staff also results in a loss of this type of funding.
Oh, we get beeps.
If they all start beeping.
We have it on paper, so you can continue.
That's all I have to say
It's,
about that.
it's thinking.
It's thinking.
There you go.
Okay.
Do we have to start the camera, or is that
Truthfully, I don't know if we can.
the stream just?
Okay then.
I don't know that we can because it's anticipating one meeting, and when the power shuts off, then it stops and it's not set up for another one, so.
All right.
either
It's okay.
Either it's still there or it's not.
I don't know that there's a lot of people in Cook County like me that are super excited about this report.
About numbers, I know that. So because a lot of the money that we are able to get from the time study, it has to do with staff hours that are logged into a state system. We also look at how many hours it is that we will be spending in different areas, and you'll see that as well. Direct cost of staff-provided programs is allocated according to the number of hours reported in each area. 31% of the expenses are in children and family services, a small percentage in child care and licensing and non-contracted CD programs, 20% in mental health services, 7% in developmental disability services, and 40% in adult services. Our social service staff also administers several additional programs on behalf of state and federal agencies. Those are centralized expenditures and again do not pass directly through our agency, instead are paid to recipients or providers. Some of these programs include the Consolidated Chemical Dependency Treatment Fund, or CCDTF, Consumer Support Grants, MEC Squared with the child care through the Minnesota Electronic Child Care Program. In the area of children's services, staff hours have more than doubled in the last 5 years. from 1,788 hours in 2014 to over 3,900 hours in 2018. Children and Family Services include child welfare, child protective services, parent support outreach, adoption or guardianship, and CADDY for children. That's the Community Access for Disability Inclusion. We showed a 14% increase in budgeted spending in this area. Expenses in this area are the result of proactive efforts in children's services. This area also showed a substantial increase in planned revenue due to improved collection efforts. Out-of-home placements is nearly impossible to budget. The need is unpredictable. This graph shows the annual number of children's out-of-home placement clients in the last 5 years, with 26 placements in both 2017 and again in 18. Staff do look back at placement history when trying to budget for the future needs of shelter or foster care, treatment or group home, or correctional placements. While the actual number of annual placements appears to be low, assistance for just one additional family in crisis could easily increase the number of clients needing services by 20%. Spending for placements in 2018 was just 45% of the budgeted expenditures. We also administer state-funded child care and employment and training subsidies. The E&T services are contracted with AEOA and are provided to participants in family cash programs such as the Diversionary Work Program and MFIP. The graph shows the funding sources to administer these programs is almost entirely from federal and state dollars and no county tax. Funding for CD treatment program services provided by our staff, as well as contracted through our partnership with Wilderness Outpatient, came from several sources in 2018. 15% from federal and state funding, 11% from the liquor license fees, 6% from client fees and insurance plans, and the remaining 68% from county tax. We are continuing to improve our billing and reimbursement processes to collect client payment fees and additional insurance payments. We provide mental health services for adult and children. After a staff shortage in 2017 and early 18, we saw a significant jump in programming hours once we became fully staffed around mid-2018. In 2018, our staff logged nearly 2,500 hours in mental health services. Expenses were close to the budgeted target. We were underspent in contracted mental health services due to the closing of HDC. We were over budget in planning for inpatient mental health services, but just like child out-of-home placements, this area is nearly impossible to predict. Annual staff hours to perform support program services for developmental disabilities has risen 60% in the last 5 years. At the end of 2018, we had 27 individuals being served by one case manager. In 2018, in your financials, you'll see there was a 200% increase in both expenditures and revenue with this program as a result of a state innovations grant that we received after the budget was finalized. This grant provides for employment services specific to this population. We partnered with HDC to provide this service, and this was 100% funded by the grant.
Was that a one-year program?
It was a 1.5 year. It ends in this year.
Okay. And we're still running it even without HTC? Or are they still our partner just from Duluth? Okay. Thank you.
In adult services, this includes adult protective services, waiver case management, and care coordination for elderly and managed care clients, and CADDY services for adults. That's the Community Access for Disability Inclusion. Even with staff turnover in this area, the number of staff hours serving clients in adult services has doubled in the last 5 years. 2,476 hours in 2014 and over 4,900 hours in 2018. This area saw a 60% increase in planned revenue due to our aggressive reimbursement and collection efforts from state agencies and health insurance providers. Next, we look at public health, which makes up 10% of our programming costs. The majority of the operational programming costs for public health were funded by state and federal dollars, and 37% by county tax. Fees and recoveries make up a small portion. This revenue covers the cost of the former public health nurse, now public health coordinator, for travel and training, emergency preparedness, and other operational costs that are directly program related. The proportional costs of programming are within 6 areas of public health responsibility. This includes both the staff-provided and contract purchased services. In 2018, these costs were incurred as 23% in assuring adequate local public health infrastructure by state and regional meetings, administration, and the community health assessment. 48% promoting healthy communities and behavior through the family home visiting program and collaborative work within the community. A small slice in preventing the spread of infectious disease such as TB screens at the jail and protecting against environmental hazards. 15% of costs in preparing for and responding to disasters and emergencies, and 13% to assuring quality access to health services. Again, this is done in collaboration with our community partners. PHHS contracts with local partners to provide services such as WIC and the WIC breastfeeding programs, Child and Teen Checkup, and the statewide Health Improvement Partnership. These programs are fully funded with federal and state dollars. I should make a note, we expect to see a shift in this area in 2019 as we've partnered with Sawtooth Mountain Clinic to administer the family home visiting program, which was previously performed by our former public health nurse. Administrative costs are proportionally shared between the 3 departments of PHHS based on FTE in those areas. The funding source for administration is entirely county tax, as these are non-program costs. These expenses include salaries for the director, fiscal and support staff, office rent, PHHS board and advisory board per diem, staff training, computer support, auditor fees, and the merit system fees. Income maintenance spent 99% of the budgeted expenditures and collected 89% of planned revenue. Reasons for this are increased electronic data management costs. We had some prior year license catch-up to do after we were audited in that area. We had decreased payroll costs in income maintenance. We were budgeted to replace a half-time position with a full-time one, and that didn't occur in 2018. And then we had those prior year estate recoveries that we ended up paying to DHS in 2018. In the area of social services, they spent 81% of their budget and collected 105% of planned revenue. We had decreased payroll costs to 2 resignations, and it took time to replace those. Increased mental health inpatient costs. There was a prior year billing that was disputed that was resolved this year. And children out-of-home placement expenses were only 45% of planned costs. Public health spent 79% of the budgeted expenditures and received 97% of planned revenue. There was a decrease in salary expense due to a position vacancy throughout the year, which resulted also in reduced expected travel, training, and program costs. The 2018 budget was adjusted last year to account for a $155,000 use of fund balance. This was to offset the additional salary costs when the CCEA contract was approved after the final budget was set. Due to the lower than anticipated expenses and increased revenue collections, we recognized a return to the fund balance of over $638,000. The Office of the State Auditor recommends that local governments maintain an unreserved balance of no less than 5 months of operating expenditures, which should provide for adequate funding until the next property tax revenue collection. The blue lines you see indicate our year-end fund balance over the last 9 years. The red lines reflect the amount that we should have had if we were maintaining an appropriate fund balance that would support 5 months of our department's expenses. Since 2012, we have continually had a fund balance less than recommended. The returns made in 2017 and 18 will restore the fund balance to levels recommended by the Office of the State Auditor. This will allow for continual funding support of annual expenditures until property taxes are paid or until the state and federal agencies release their funds. And as we've learned, they operate on several different calendar years than we do. Any questions?
That's for the fund balance. That has been horrendous for the last 6 years. It has been scary. These are year-end numbers,
Yes.
and so for everyone else to understand that until property tax revenue comes in, these numbers were not very pretty. So thank you for the work that you've done, that you did with Yafa. Thank you for the work that you've done. Thank you for the work from this board and for being willing to stick to the taxes that we did for the citizens, because this is huge. This is a major big deal. Sorry, I'm so excited about it. But anyone else have questions?
No question, just a comment about your fine work here. I love graphs in color because when I print them out, they're only black and white. So it makes a huge difference to be able to see it, proportionally. So thank you for this report, for sure. So the fund balance right now is where it states here at $1,475,000.
Correct.
Okay. Until we have the tax revenue coming in.
That fund balance is money that is set aside, that is to cover our expenses. When you think of your first half property taxes are due in May. And so from January to May, we're making payments that are going out without having revenue coming in. So that is it's not a cushion, it's not a rainy day fund, it's money that's set aside specifically to cover our expenditures for the first 5 months. Then in October is when the second half of the property taxes come through. By then, we will have started receiving some of the money from the state and federal agencies for all the grants that we get from them, from their funding. We've learned that they operate on several different fiscal years. We've got fiscal years that begin in January, some that begin in March, several in July, and some that start in October. So we get money periodically throughout the year, but there's that first 5 months of the year that we don't have money coming in for this year. We may see money that comes in, but that's previous year money.
Suppose it would help if everybody paid their taxes in May. the
And
full
everybody
tax.
doesn't pay their taxes. If you look at that, we collected 99% of what we were expecting to see in property tax returns, or property tax income coming into the
For
department.
this year?
For 2018, yep.
Yeah. Okay.
Jeff,
Thank
did
you.
you have your hand up?
Yeah, and just a note about fund balance. Ideally, the fund balance just stays there, and we don't use it. We do use it for current operations at some point in the first few months of the year. But we do intend, when we budget, to balance our budget of revenues and expenditures to the point that at the end of the year, we should be at the same place. So, as Lori was saying, it's not earmarked money. It's set aside to offset the cost of operations during that period while we're waiting for revenue. But our goal with budgeting is to budget for a balanced budget, or budget to put just a little bit back into the fund balance, because if you look at that chart, what we need to have set aside grows a little bit every year as our costs for providing services grow every year. So, fund balance is a snapshot. And the operating revenues and expenditures quarterly is also an important piece to be watching, and the end of the year. So, and the only thing that I would definitely caution is our good fortune last year related to fund balance was related significantly to several positions that we didn't have filled during the course of the year. And that's not necessarily how we want that worked out, but it taxes the staff that we have. It taxes the people who are counting on services from us. It's not a way to build fund balance is to not have positions full.
Right. Myron?
Madam Chair, thank you. Yeah, just to clarify that, so I understand the fund balance and how this is a snapshot. And are we currently having any positions that are open so that would help us understand how significant this is?
We've had a vacancy in the public health area for an
Right.
entire year, and
Right.
there's actually going to be something, an adjustment to that coming up here in a few minutes. I don't think we had any other staff vacancies throughout the year that would be adding to the balance.
Just a half-time in income maintenance, which was pending Pat Strand's transition to full-time veteran service officer. That .5 FTE was vacant for 2018, but has since been filled. Going forward, both of our position vacancies at present, one is a replacement position for adult services. The other is the new position for the community support worker, which will be using grant funds from DHS. Does that answer your question?
So that would have an impact on this fund balance when those are filled?
No, because there are funds allocated in the
There-
budget
okay.
for both
All
of
right.
those
Thank you.
positions.
It affects the fund balance when we don't fill it, and then
I agree.
when we balance.
Just want to make sure that
And
this
if
is
I may,
up to
also, when
date.
you see some dipping that took place starting in 2012 in the blue where it was being dipped down, we've learned that some of that area of use of fund balance had to do with positions that were added during the year after the budget had already been set. And then a position would be added during the year.
Thank you.
Any other questions? Yes, sir.
So on that note, would the recommended balance also change when a position was added?
Once the budget is set, we should be looking to see that we would have a fund balance that can hold at least 5/12ths of those expenditures that are set in that budget. When a budget has been set, and then say March, April, May, somewhere down the road, that money or that position gets added, that's an unbudgeted area, and we can't at that point request an additional levy because the levy had already been set, the budget had already been set previously.
But it'll change for the next year when it becomes part of the next year's budget.
Correct.
Does that make sense?
Two other comments about fund balance. One is that Health and Human Services fund balance is one of the main fund balances that we have. Another one is the Highway Department fund balance. And then the third largest one is the general fund unrestricted fund balance. And our target per auditors and bonding consultants is 75% of our operating for our general fund in the general fund balance. But our fiscal policy, our budget policy also identifies 50% of our total operating costs in fund balance, and we have not reached that in the last couple of years. We've been operating under 50%. And just to quick do the math, from January to May is 5 months, 5/12ths is 42%. So 50% is not a crazy number thrown out there that's, this is extra money. As Lori said, this is operating reserves for us to get through from January until we collect payments. So while this fund balance is here and the general fund balance has been around that 75, 76, maybe even 78% range, our Highway Department fund balance is nowhere near where it needs to be, which means that overall, we're not at 50% of our total operating revenues for county operations yet. And this is good news. The general fund is good news. The Highway Department fund balance should be in the same neighborhood as the Health and Human Services fund balance of $1.5 million approximately. It's important to look at all of those things together. I know today we're specifically talking about this one, and this is good news, but.
Myron?
And that's just a direct result of over the time accumulatively, we just haven't been budgeting the highway fund as a board. Or are there unforeseen things that have happened there?
Well, it's a combination of things, but
Okay.
from 2009 to 2015, there was actual budgeted use of fund balance to balance the
Right,
budget.
that's my-
And this board has changed a policy to balance to a balanced budget.
Right.
Increasing revenues to not plan to use fund balance to offset expenses.
Thank you. I think that's important.
Anything else? Thank you for your work. Thanks to all the staff upstairs. I know the camera's off, they can't hear me, but it's them working with you and making sure you have the data you need to plug everything into the right spot. So it's fully a team effort up there, so thank you. Thank you for the report. All right, director's report.
Thank you, Commissioner, and I just want to echo again, thanking Lori for the work that you put into this report. It's been a pleasure working with you on this and just reflecting on the last year, and again, all the hard work of our staff. I again want to say that the numbers here in showing our return to fund balance really do reflect the hard work of our staff over the last year, particularly in the areas of out-of-home placement, where we spent less than we projected. That really is a testament to the work of our Children and Family Services team in working with families to prevent those placements when possible. Also want to recognize the fact that we were short-staffed in public health for a whole year, and what that meant for our outgoing public health coordinator, Joni Christensen, and the additional work that she took on over the course of the last year while we were planning for the transition of the family home visiting program. So thank you to Joni. And also thank you to the board for supporting adequate staffing levels in public health and human services. Again, I really feel like this presentation tells the story of how having enough staff to do the work has resulted in finally an adequate fund balance for our department, and additional revenue earnings as well, and the ability to capture revenue that historically had been left on the table as we've staffed up our behind-the-scenes staff, our fiscal and our admin staff. So thank you.
Yeah, that was a tough conversation, trying to explain that we would have offsetting funds and that we needed this not only for the community, but the big picture. That was a hard conversation. So this is the result of all that hard work. And I hope that we're able to provide all the services that we need to.
Yeah, again, just want to echo that having that adequate fund balance allows us to be prepared for the unknown expenses, especially in the areas of adult mental health placements, children's out-of-home placements that are so very difficult to predict. That, again, adequate fund balance protects our department against not having the funds to continue to operate our programs. A few staff updates. We are currently waiting on a list of applicants to be referred for the new community support position. Our first review of applicants begins this week, and we tentatively have interview time set aside for the end of next week. We are also recruiting for an adult services social work position. This is a replacement for Diana White, whose resignation you accepted at the last regular board meeting. We are also requesting approval to bring on an unpaid summer intern in the public health department. You should have received a position description and a memo in your board meeting packet. I've asked Grace Grenager to be here this morning to address any specific questions you might have about that. That is under items for board action. And if you'd like, we can give a little summary of what that position will look like. No?
Mm-hmm.
Sure. So there is a student at St. Olaf College who is hoping to intern with me in the public health department over the summer to learn more about the field of public health and to help specifically with the collaborative projects that I'm working on with Sawtooth Mountain Clinic and the ISD 166. It's a program to better understand the needs and experiences of people who've been pregnant in the last 3 years and are parenting young children under the age of 3. So the bulk of her work as an intern would be helping distribute surveys to people who are eligible and kind of fit in that population of having been pregnant or a partner of someone who's been pregnant in the past 3 years. And the outcome of the survey and also 2 different listening sessions, which I brought flyers if folks want to see. I don't know where I should put these. The expected outcome is that then we will be able to report back to people who participated and also to service providers in the community to better understand where we're providing services really well and where we can improve. So the bulk of the intern's time will be working on this project in collaboration with the schools, the clinics, and public health and human services. The intern, her name is Abby Benissa. She's a second-year student at Sinoa studying biology and Spanish, and she's interested in exploring a career in public health in the future.
Just to anticipate some of the questions you might have, practically speaking, we do have office space available for her in Grace's office. Her office is actually designed for 2, so she has a small workstation that we've reconfigured from other office changes that the intern would be able to use. We also have a spare laptop that she would be able to use, so we don't anticipate any significant costs that we would for adding a new position, for example. It is a summer internship, and again, this is a project that we would love to support, a collaborative project working with the clinic and the school, something we just don't have the capacity to do with a public health department of 1. So having this intern is just a great opportunity to be able to support this work as a department.
Does anyone have any questions? Go ahead, Jen.
Was this a program that you were looking for, or did St. Olaf come here? How did it start?
The clinic actually referred her to me.
Oh, okay.
And we had a conversation on the phone. So she has a friend from January who she's going to be living with over the summer.
Mhm.
And it kind of just happened coincidentally, I would say. We didn't post the position.
No.
Although it's something, if it goes well this year, I mean, I love the idea of giving people exposure to the world of public health and also adding to our capacity through summer interns. So.
Sure.
We've been contacted in the past and just haven't had the capacity to take on an intern. And again, there's many levels of benefit to introducing students to the area of public health and the community and just building capacity for the future in this work.
And she has a place to stay?
Mm-hmm.
Good, okay.
Yeah.
Second important thing.
Yeah.
Maybe the first.
And she would be working 5 to 10 hours a week throughout the summer.
Yeah, okay.
And then returning to school.
Any other questions for Grace before I continue on with my report?
Go ahead.
We hosted an open house information session for the local advisory council for mental health on May 1st at the community center. There were about a dozen attendees, including some current members of our Public Health and Human Services Advisory Council who are on hand to be able to share their experience serving in an advisory committee. We've had quite a bit of interest. We've received maybe 6 applications so far. Our next steps will be reviewing the applications, contacting those who have applied to let them know our time frame for review of applications, and then recommending names to this board for appointment to that committee. You'll also notice that I have resubmitted the bylaws under items for board action and just want to explain that the only change to those bylaws from what was approved at last month's Public Health and Human Services Board meeting was the addition of a provision on reimbursement for members. That was just an omission on my end, that I did not include that. The language that I've added is directly from the Public Health and Human Services Advisory Committee on mileage reimbursement for committee members. So again, an important way for us to be able to encourage people to apply and to recognize the work that they're putting into these committees on a volunteer basis, that they're able to get some reimbursement for their mileage. There was a presentation at the Public Health and Human Services Advisory Committee earlier this month from the American Lung Association on tobacco use in the schools, particularly vaping, e-cigarettes. They presented some local data as well, and Carla will be sharing more of an update in her committee report about that presentation and some of the recommendations that the committee has made for next steps. Also want to share some good news. We received a report from the State Department of Human Services. Many of our programs, again, have that oversight from the state and federal government to ensure we're meeting performance standards. We received a summary report for 2018 for timeliness for cash assistance and SNAP applications. And I am very pleased to share with you that Cook County is meeting or exceeding performance standards in both areas for regular application processing and expedited processing. So when household units need emergency support in accessing food benefits, let's see, 82% of the time, those applications are processed within 1 business day in Cook County. The performance standard is 55%, and Cook County is outperforming the region and the state in that area. So again, kudos to our income maintenance team for their excellent work in improving our performance there. In the area of regular SNAP and cash applications, we are processing 95% of applications within 30 days. And again, that is exceeding both state and regional performance. And this is an area where in 2016, we had a performance improvement plan. Our performance was just under that threshold for performance, so it's significant gains in just the last few years. And I'll run this. Also wanted to share with you that we now have our updated resource guide posted on the county website. This is on the PHHS page of the Cook County website. It includes information on local, regional resources that we frequently in Public Health and Human Services are referring the people that we work with to. This is available to the public, and it's, again, posted on our county website. And it's intended to be a living document where we're updating it regularly. So encourage anyone who would like information added or has questions about that tool to contact our agency. Lastly, want to give a brief legislative update. Lots of changes, recent changes. The Health and Human Services budget deal was reached over the weekend, and that included the repeal of the provider tax sunset, which is a significant priority for both AMC and for MAXA to repeal that sunset. The percentage was reduced, however, from 2 to 1.8% going forward. Also, the top AMC priority, the Opioid Stewardship Council bill, was passed off of both the House and Senate floor by overwhelming majorities and will likely be signed into law by the governor later this week. This raises $20 million per year in new wholesale manufacture and distributing fees that will be directed at a variety of initiatives aimed at addressing opioid addiction, and that includes nearly $8 million a year to county and tribal social services for child protection services. So more to come, as likely a special session will be called to continue working out the policy details of the budget bill. And that's all I have for updates, unless there are questions for me.
Any questions?
Do you know how that reduction in the down to 1.8 will affect us?
I don't.
Okay.
We currently pay, I believe our provider tax in 2018 was $82 a quarter, so less than $400 for the year. And so it's going to be dropping down just a little tiny bit. It's not very much that we pay at all. We pay the provider tax on services that we provide through the Wilderness Outpatient Treatment Program. That's the only actual service that we provide that's it's not a medical service, but it's a provided service that's included in who has to pay the tax on it.
The,
That also funds the public health programs, so it comes back, like the statewide health improvement program is funded through the provider tax. So some public health programs could be slightly affected by a reduction.
the provider tax generates approximately $800 million a year statewide, so a 20% reduction in the provider tax would be about that much. So it's better than having an $800 million gap in funding. But that's a 10% reduction to that number, so it is $80 million overall.
But Lori brings up an interesting point that in addition to supporting our programs that we're providing locally and at the state level, we're also taxed by the provider tax because we are a provider of service.
And they do not provide a sunset right now. So they'll have to work that out, hopefully. See how it goes.
It was just repealed, the sunset, but reduced by that
Yeah.
0.2%.
That's what it said in the morning paper, so we'll see by the special session.
Right.
All right, there's no further questions. Move on to items for board action. You want to take them one at a time or as a whole?
I'll make a motion to approve all of them as a whole.
Support.
Any further discussion? All in favor?
I was just
Go
gonna
ahead.
say, I thought it was worth noting on item C that there is no change. It's just kind of an accounting, moving of money, so that's just worth noting. But otherwise, and the bylaws, I think that change was mentioned, and then we talked about the intern position, so it's all been covered.
All right. Any further discussion? All in favor?
Aye.
Motion passes unanimously. All right, committee reports. Dave, Arrowhead Economic Opportunity.
Yes, we did meet, and I guess my big takeaway from that meeting was just the Rutabaga project, which was new to me, and I thought that was pretty exciting between what's happening in Grand Portage, what's happening in Cook County here as far as the Northwoods Food Project, and now the Rutabaga project. It was just a fairly significant movement towards growing food locally and keeping communities healthier. And I didn't know such a project was happening on the range, and it's pretty significant. They did a survey, much like the Northwoods Food Project did, about the economic potential and the economic impact currently on regional food, and it was significant and nothing to sneeze at there. So I kind of reported that back to Diane Booth with the Northwoods Food Project, and she was familiar with it, of course. But it was just good to, I guess, bring that back home. Otherwise, there was kind of a quick board training for Head Start, and there was going to be a Head Start meeting here, and I haven't heard anything about that since the meeting. But that was a change in timing because of federal funding. It was required that we did it right then, lickety split, instead of in the fall, which I guess when it normally happens. So I guess that's all I'll report.
Arrowhead Health Alliance.
And we did meet. Allison was kind enough to share her office for that meeting, just the telepresence, and a little bit of talk of the facility there in Duluth. They've been having some plumbing issues that are ongoing and significant, so just kind of recapping what's going on there, as well as they had a concert that was pretty successful to bring mental health awareness, and that was in Duluth. And so that's going to be continuing annually, is my understanding, and they're very open to suggestions for what bands would be willing to perform there. I think it was Trampled by Turtles the first year, or Charlie Parr.
Yep.
And so there has been a bluegrass-ish theme, but that's not necessarily how it's got to be. And just, I guess, some reporting on the numbers as far as how much use the facility gets, some of the barriers that are still challenges to getting more people in there, and just the need for that type of facility. Didn't know if there's anything else you wanted to mention about that, Allison.
back at my notes, I don't think so. Capacity is up. They reported that capacity at Birch Tree Center is up in the month of April. They didn't have the exact numbers available yet. But there was some discussion about that. Sarah met with Rick, who is the coordinator for the AHA board, and he set us up with some new equipment in our PHHS conference room.
Oh, great.
Um,
Well, that'll hopefully help with the community health board, or I guess it was more on their end, but
He was going down there now. so
Okay.
after he was here.
excellent.
And an update on the Clarity project as well. The project was short 1.3 million in funding for the bonding project. But I believe that was in the governor's budget. I don't know if that was approved.
Yeah, it sounded hopeful, but I haven't heard anything since there.
All right, Arrowhead Regional Corrections, Bobby?
Yes, we met last Friday. We kind of had our retreat thing. Kind of seen where ARC's direction they're going. It kind of looks like they're going to be looking for a new supervisor this year and the upcoming year. And they're hoping to get bonding for the meat processing project because the original money that they got is going to go away if it doesn't get spent. So, and one of the, I guess Myron and Heidi would know, one of the St. Louis County Commissioners, in his opinion, would like to disassemble ARC. And at our next board meeting, they want to know if Cook County supports being an ARC. You know who I'm talking about.
Oh, yes, very well.
You know, and I think they just want me to bring that back, that, you know, we're happy to be in ARC and.
Are we?
Well, I'm curious why the.
I never met Commissioner Nelson.
No. No,
We allocate some of our levy to support ARC.
Yep.
And so Commissioner Nelson in Duluth is very tight on the wallet.
It's because
Is that-
St. Louis County picks up 85% of the budget.
okay.
You know, it's a $23 million
Yeah.
budget, and he wants total control.
He wants 100% of the budget, is that?
Yeah, and then we'd have
Then
to
you'd
go
just
and do
be-
our own thing.
Sure.
You know, probation-wise and whatnot.
Sure.
If I could just comment, you know, we'd be cutting some benefits to our people here.
Mhm.
That is a real good deal for us, for our people, and especially, it just provides the service. There's no way we can do it, so we'd have to contract it out. Like, most of it's residential, and long-term, and it meets certain requirements, and, yeah, you said it well. You know, they have their special interest, but I think it's a fair system. It's based on numbers
Yeah. You know, I
and
think-
usage, as well as, you know, a certain administrative fee.
Yeah, I think ARC was put together in 1976, I believe. And when it was put together, my uncle Chet Linsku was on that board. So.
Okay.
Should we send a letter of support?
No, it
or
doesn't
s-
bring it back.
Okay,
to them,
okay.
so.
Thank you.
Anything else from that? Arrowhead Regional Development, Ginny?
Thank you. We had a presentation on the Juniper program. The Juniper program is one for healthy living for seniors and trying to get them moving more. And it's a program that I am going to contact her about possibly doing some things here in Cook County. I think they do help in some aspects with care partners and that type of thing. But they're willing to go anywhere in the 11 counties, so we'll see what we can work out.
Great. Community Health Board, Dave?
Yes, we met and little bit more talk about strategic planning, and then also there was a little bit of a scares from my perspective, but it sounds like it's more or less worked out, or sounds more optimistic than I was taking it, just regarding St. Louis County exploring the idea of pulling out of the Community Health Board, and that
Who's on that board?
The same member?
I don't know. But I think it's just worth them looking at because of the restructuring of, because Louise is going to be retiring, and so it's just worth looking at everything there. But that would pose a challenge because you need to have populations of at least 30,000 with combined counties, and they also need to be contiguous counties. And so Cook and Lake counties would not meet the population. There was, and I forget her name, but a woman from the state who said that she'd be very supportive of working something out if this does happen. But hopefully it will not. And it kind of sounded like it was a little bit softer of an explorer than anything real serious. I don't know if you want to comment on that, Grace, or if you've heard more since. I mean, I brought it to the the Public Health and Human Services Advisory Council, and
We are having monthly strategic planning meetings in anticipation of the leadership change that will happen when Louise retires later this year. And I think St. Louis County is exploring it, but there's not a definitive action on their part at this point. So the last time we met, which was after the last CHP meeting, if there was a facilitator there to talk over, there's 4 counties, Lake, Carlton, St. Louis, where we're all in agreement, where things are working well, where there could be differences of opinion. And then Janelle, the consultant from MDH, who Commissioner Mills referenced, she also interviewed all the county public health departments to see what our experiences were. And so from those notes, we have this discussion, and it will continue. June 7th is our next meeting, and I'm hoping we'll have some more information to share after that.
Does it take county board action to withdraw from this committee?
If St. Louis did decide to retire, I'm not sure whether that would be their board. I do know that from the consultant at MDH that they would have to have an entire calendar year where there's a transition process where we would be forming some alternate community health board structure. So it wouldn't be before, the 2019's already started, so the entire 2020 calendar year would have to be a planning year if something were to happen this year. And then, but it's not clear whether that would happen. And I'm not sure whether they would. Or it would be, I'm not sure what it would look like exactly.
Okay. Ginny?
So is it dissolving because of somebody retiring, or it's dissolving because she's not there for leadership?
it's not dissolving. I think they're just taking with the change, they're taking a step back and looking at everything as a whole. Would you? Yeah.
It's not dissolving, but the strategic planning was happening regardless
Right.
because of the leadership change, and then,
Oh, so that's, okay.
so that was
The
what
impetus.
prompted the
Yeah,
conversation.
yeah. It did bring up some of, I was alarmed hearing about it, but it doesn't sound like it's necessarily alarming at this point. It's just, they're
And-
looking at it.
Is it all part of the 11 counties? Are all 11 counties involved?
There's 4.
4? Okay.
Yeah, Cook
Long as you
Lake,
be
St. Louis,
contiguous.
yep,
Okay.
and Carlton.
Okay.
So, if that did happen, St. Louis would be their own, because they have the population. Carlton could,
Go
You
with
know.
St. Louis,
Well, I think St. Louis wanted to be on their own, but Carlton could go to Itasca or Aiken, or, yeah, there's others. But we can't go to Canada, which was brought up as a joke, but
They have a good healthcare system.
that's what I hear.
Great, thank you.
Wow.
Carla?
Yes, Dave shared his piece of what happened at our meeting concerning, and I have not heard anything, so maybe someone else has heard. Steve Nelson was talking about that the House wants to cut $250,000 out of the budget that would go, that portion would go to our hospital and care center. And I listened, but I don't hear anything about that. Does anyone know? Okay. Okay. He said that would give them only two options, to either raise their levy or cut some services. So hopefully that won't happen. The other thing concerning the hospital and the clinic is that they had their boards meet together to kind of look at the process of how you do effective strategic planning and planning for the boards, and working together and using similar tools, and so that was good. The other thing that Steve raised that has potential issues is that they are renewing, their contract with St. Luke's is coming up for renewal. And they're looking at ways to tweak that and make it satisfactory. But one of the issues is it appears that St. Luke's is the only hospital willing to do this kind of rural work, and Essentia is not. And so they're really feeling that they want to make this work out, because it's added, I think, a lot to the service component. So that's a wait and see, but it's not profit-making for them, even though they got 92 referrals. Well, Essentia does too, but living here, that's where we refer anyway, whether we're affiliated or not, so that's the problem. And the other compounding factor is that their CEO is retiring, and he has, whether you call it philosophical or a passion for rural health care, and is very supportive of that, and they want to nail this down before someone else is hired this next round of contracting. Okay, then I would say that the majority of our meeting was spent listening to a presentation by Amanda Cassidy and Taylor Blakeman of the American Lung Association, and they have, not those two, but other representatives have come over the years I've been on the advisory council, and it's very impressive, and some of it's kind of alarming on the increase of products that are happening. And they give, I think, wouldn't you agree, a really thorough and comprehensive presentation. And one of the things that they brought was a statistic that said, in Cook County, this was from 2016, 30% of 8th grade students were using e-cigarettes. And there is some national trend that this can lead to tobacco later. I know people want to see it as a sensation product, but for tobacco. Unfortunately, some of the products, particularly this Juul, or was it Juul they pronounced it?
Jewel.
Juul, okay. Of course, it's all flashy and flavored well, but many of their pods for vaping contain double or triple the strength of a pack of cigarettes. So the children are actually getting more nicotine than if they smoked. So we talked a lot in there and asked many, many questions. And as you know, Tobacco 21 is something that some states and counties and cities are adopting resolutions on. And there was something on the news last night about the federal government is becoming alarmed about the e-cigarette thing and the vaping and so forth, and tobacco. So we made a motion to support the adoption of a Tobacco 21 policy for Cook County. We're not like saying you have to do it. No. And we recommend you have a future presentation from this organization, because it was really outstanding in letting you see how it's infiltrating everywhere. And of course, if Cook County and the city decide to go this way, it's a process. You can't just go, boom, it's done. It's a process of buy-in of a lot of entities. And then I think thinking of ways, there aren't any formal quit smoking programs for minors. They're all geared, you have to be an adult to enter them. But I don't know, does it steal their thunder if I tell them about the sweatshirts? When they present this, first of all, of course, I'm so out of it. I didn't know this is the cool thing now in high school. Remember, in my generation, that the people that were out back smoking were the JDs and things like that, the loose girls, But this is now the cool thing. No, it's true. That's what they were called. Anyway, this is now the in thing, what the in crowd is doing. And so it's all over social media, regrettably, showing how attractive this is. And there's also counter things coming out from organizations like the American Lung Association. But they now sell vaping clothing, because a lot of schools are outlawing this. And there's a way to take your hoodie and wear it, and then you have one tube that has the product, and you can sneak it up like this in class, and then blow out all the vapor into your sweatshirt. So there are ways that they're able to vape constantly and get even more nicotine. And they'll tell you about the secondhand effect and all of that to people. But I thought it was very powerful, what they did.
Yeah, the thing that really pushes me over the edge on that topic is how sensitive developing brains are. And when you introduce an addiction at an early age, it creates an addiction pathway in the brain, in your neurological,
There's a little spot back here
Pathways.
that once you hit it, that's it.
And so, speaking to the opioid crisis too, when that addiction pathway is triggered, then that is just a gate, just an open door for any further addictions, and I just think there's great danger there.
I talked to my youngest because I knew the numbers at the school, because they have, each door has a box at the end of the day from the collection of students who have their little devices. They try to sneak and hide their behavior. And so my youngest is still considered in with that crowd. And she just said to me that I am the only person in her life that has ever discussed addiction with her. That, at school they might say don't do it or it's not allowed, but they don't explain addiction and that trigger and how it happens and how it sticks. And, she has family members who have addictions, and it's like, and even though she knew all of this, and even though she sits and watches her father, she used to just attack the man endlessly about his tobacco use, and here she is. And she's like, doesn't get it.
And the addiction isn't even speaking to the harms of vaping or tobacco use. There's those as well, but it's just that the thing that pushed me over the edge was the neurological.
And adults have those pathways too.
Absolutely. Oh yeah, and it sticks when you develop it as a youth. It'll stick throughout your life. So it's just a lifelong challenge at that point.
And I know like a year ago, and I think it's U of M is doing studies, they're trying to figure out if there's a way to numb or block that sense in your brain, if there's any way to get to it. And they're trying to do studies, but there's not a pill you can take to shut it off. Once you turn that switch on, it's on.
You choose to have them present, figure on an hour, and they're always much longer than we expect, right? Because we ended without doing anything more, but it's well worth it.
Ginny?
I was in a gas station in another area a while back, and all of their Jewel products were behind the counter in a glass case, and I thanked them for doing that. And they said, well, that was one way that they could help, not eliminate, but help look at each person as they would come in and ask for that. So anything we can do to keep it behind the case right now until we decide about an ordinance here. They did not have one there where, in that county.
If I might add too, we had also discussed that a part of that recommendation might include broader community presentations to the school, to parents, to medical professionals. As I remember hearing from some of you after the last Joint Powers Board, that this was a major topic of discussion, and there was a lot of interest in how can we learn more to help prevent and intervene sooner when we see this activity with our children. And this is a support that we are able to tap into because of our community health board. These educators are, and correct me if I'm wrong, Grace, but they are a part of the regional community health board, and that they are able to support Cook County with this work. And they're contacted with the Public Health Law Center and are able to provide a lot of technical assistance on the ordinance.
Great. Myron, you had a question?
Well, I was just going to comment, and I think the ordinance is part of it, but having worked in education and had dealt with some of these areas when other things have developed, that it's got to be a multi-pronged approach, and I appreciate your comment about community, because typically the past practices in this is just to pass an ordinance and just say no and teach kids how to say no. That doesn't work. You got to teach critical thinking skills, and has real implications for the schools, but I think also for the community and for parents, and definitely education. So I think that if we get into this, we should, consider those aspects of it to be more effective, because there are things that can be done. There are things that can be taught. There are a lot of resources, but it takes a whole lot of effort, and it takes a commitment, and it costs money.
Are we done on the tobacco? Because I have.
Yes, you can
Okay.
move on.
All right, I'll light up. Okay.
It's not lighting up anymore, it's vaping.
Okay. The Mental Health Advisory Committee, as Allison said, we had an open meeting, and we had some pretty good attendance. I sense it will be easier to recruit people who have been providers or are providers than some of the actual, what we need, the 51% of individuals who have had a mental illness or have one or a family member. But we have, all of us, been trying to approach people and talk to them. And I think it may be slow, but I get the sense that people are opening up more and more to doing that. We did, as the meeting progressed, which was great, it did shift from, of course, they had to learn all about it, and that was presented very well by the staff. But it did shift to people beginning to brainstorm, like what would be, in this shortage of therapists here, what would be some other kind of things that could help a person with mental illness. It could be, we don't have protocol with how you handle it when someone comes out of an institution, like out of a hospital, or when they're ill and in a place, how we respond to our neighbors and friends in those situations. And as I have been trying to talk to a number of people about joining this, and there is a sense, just the people I saw, of some discouragement of the depleting of services here. But also, I'm trying to help them come out with other ideas. For example, maybe a group of veterans could get together and kind of, as peers, have coffee and support each other and just network that way. And so hopefully, as I discuss this, particularly with this one vet I've been talking to, hopefully he'll come forward and do this. And I think wheels were turning, but it may take a while, that we can do a lot of things, like just be sure we include someone the next time we have a group hike in the neighborhood or something, call someone up who maybe wouldn't come out of the house to join you, at least invite them. So it was very interesting how people began to brainstorm things. So I think it's going to go. It's just going to be a process.
Do we have applications up at the Y?
We don't, no. We have applications posted on our website and available by request from PHHS.
If you can bring some to personnel today. I'll bring them up to the Y because the Y is recognizing Mental Health Awareness Month, and they have the Make It Okay flyers out in their lobby. So we could put the applications out there also, I think.
Great idea. I'd be happy to have those for you.
Okay, and I'll bring them up there. Do you have anything else, Carla?
Oh, that's it.
Okay. Ginny, healthcare planning?
Well, Rita sent out the notice about having the meeting. Not many people replied, and so she figured that we were all at the beach. So we did not have a meeting.
Okay. North Shore Collaborative, Dave?
Yes, we did meet and approved a couple grant requests. The ones that come to mind are embroidery machine for the Silver Bay High School. They're going to be doing all their own embroidery work, as also learning how to do that and then just providing that for the school, whatever needs they have. So I thought that was pretty cool. And then also a piano dolly for our school. So, yep, I think that was that was right after the foot of snow. So that was the other memorable part of that meeting.
Emergency preparedness, Ginny or Myron?
Okay, we had the emergency conference last weekend in April, and I was able to attend the sessions on Friday, and it was very well done. Hats off to our emergency services director and Valerie and the other staff, and I think you helped with the meal.
2 of them.
2 of them. So thank you for that. Good emphasis on the kinds of skills that are needed for our emergency services people in the county. It's just a wonderful way that we don't have to travel someplace else to get the training. And the sessions that I attended were, I think, very good because it had a focus on we've got to take care of ourselves as well because of all of the exposure to trauma and so forth. And so they had some real good sessions on that interested me about vulnerability and so forth. And so good conferences, and hats off to everyone that makes that work. It's very worthwhile.
Thank you.
Amen.
And the last item we have is for the good of the order. Does anyone have anything for the good of the order to end on a positive note? I'll just reiterate how lovely that fund balance looked at the end of 2018. I know it's a snapshot in time, but it's been a long time coming. And thank you, Grace, for all the work that you do diving in. All right, with that, we will adjourn until committee of the whole at 10:30.
Let's see here. We were on camera, and we still are. The power,
It turned on?
it kept going. Was there a blip?
I was hoping that.